Thank you very much and good afternoon. Today, we're going to walk through where we are in the pandemic and talk about where we're going next. To start with, where we are today, we are progressing well and we're going in the right direction. And it really is thanks to people in British Columbia stepping up and doing what we needed to do. We now have over 55% of children 5 to 11 who have been vaccinated. Over 90% of British Columbians 12 and over have received their first dose of vaccine, 2 doses of vaccine, and about 56% of people have received that important booster dose. Our hospitalizations continue to decrease, which is also really good news. If we look at it in terms of our epidemic curve, we see that our cases of lab-confirmed cases have come down dramatically in the last few weeks, but really importantly, our hospitalizations have also decreased and the number of people in critical care has decreased. This is encouraging because as transmission goes down, so the risks to all of us go down in the community. Our approach has always been to only have the minimal necessary restrictions to keep people safe and to prevent the transmission, particularly to those who are more susceptible to severe illness with COVID-19. It is finding that balance. I am incredibly grateful to the millions of people throughout our province for your willingness and support in adopting our COVID-19 safety measures. Your efforts, combined with these high vaccination rates, have saved countless lives. Together, we've done what is right at the right time. And now we are in a place where we can once again adjust our approach. If we look at our hospitalization rates, another important measure, of course, is by age. And we know that it continues to be our elders and seniors across our communities who are more at risk of severe illness and hospitalization, and thankfully that continues to come down as well. We have a number of different surveillance measures that we have been following closely. One of them, of course, is our wastewater surveillance, and we see a consistent decrease in low levels of virus now being detected in wastewater. And so that is also another important measure that helps us understand where we are in terms of risk in our communities. If we compare where we are compared to other jurisdictions across the country, we see that we have had a lower peak and a slower peak than many other places, and our hospital admissions specifically have decreased by about 34% in the last month to less than 100 new admissions each day. We also know that with the Omicron variant that has come into play in the last few months here in British Columbia, that admissions to hospital with COVID have decreased more than people who have been detected with COVID. And if we can, the same comparisons with other jurisdictions around the world, we see that the actions that we have taken here in British Columbia and that people have stepped up and been vaccinated has meant that we have fared well compared to many other jurisdictions in the country. If we look at our hospitalizations compared to the modeling that we've been following over the last few months in particular, we see that we've tracked along where we've expected to be with the rate of vaccination and immunity that we have in our community and with people taking those measures that we put in place to prevent transmission. And we expect that to continue as we are in a good place today. We are one of the most vaccinated jurisdictions in the world. And that layer, that protection that we get through vaccination and that immunity that we have across our communities has meant that we have been resilient in getting through the Omicron wave. It has protected. And yes, the risk of infection with Omicron and the protection that we get from 2 doses of vaccine is less than with some of the other variants, but we have seen very strong protection against severe illness, and we do know that people with 2 doses of vaccine are less likely to get infected themselves, less likely to transmit to others, and that increases the protection that we see with 3 doses. With that booster dose, bumps it up to over 60% protection against any infection, and that again protects against transmission to others. We also on this slide have put in some of the additional immunity that we have in our community from people who have been infected, particularly recently with Omicron, to give you a sense of the small proportion that is also an increase of protection that we have of immunity across our communities. We know that people who have 2 doses of vaccine on board who got infected with Omicron, most of whom thankfully had a relatively mild illness, have a good, strong booster effect from that infection as well. This means that the level of immunity that we have across BC right now means that we can take some of the tools that we have been using consistently and repeatedly and relax some of these measures. The most, just to follow up on our whole genome sequencing that we've been doing. We can see the red is when Omicron came on board. We are starting to see some geographic changes in variants. They're all considered Omicron, but as we see, as it replicates, it can change slightly. And we've seen the BA1, which is the lighter red, and BA1.1, which has increased in the recent weeks, and a little bit of an increase in the BA2. That is one that we've been watching carefully around the world because it does seem to have even increased infectiousness, but so far we're not seeing a rapid growth in that. And as numbers of cases have come down, while the percentage is going up, the absolute number of people with BA2 is actually going down as well. And it tells us again that as rates of transmission go down, we're all protected a little better. So what does that mean for us now? With the science and our data top of mind, it clearly shows that our risks now are much lower. They're not zero, and we're not fully out of this yet, but I feel confident that we can safely make some further changes. For many months now, we've had a number of tools in our toolkit that have helped us to get to this point. We've had to use all of them, all of the time, and we are now transitioning to using some of our available tools some of the time, because we are in a lower risk place. As of 12:01 tomorrow, so not 11:59, 12:01, March 11th, the following changes to the Provincial Health Officer Orders and Guidelines will come into effect. Firstly, I will be repealing the face covering order. The order restricting overnight child and youth camps will be lifted, and that's one that will be of particular interest to some parents in particular, and camp operators. This was the order that required that a specific COVID safety plan be in place and be approved by MHOs, so we can now start to plan for having summer camps for children and youth. We are going to restore the visitation policies that we had in long-term care prior to the additional measures that we put in place for Omicron. So that means starting a week from tomorrow on March 18th, we'll be restoring a long-term care visitation, and the goal will be to increase visitation and opportunities for connection between residents and families while continuing to protect those we know are most vulnerable to serious illness. We know that there are some challenges across the board, but including in long-term care with things like staff shortages, and operators may need to manage visitation based on the situation with each individual care home. So what I'm asking for is patience. Over the coming week, all of the care home operators will communicate with families around their plans for resuming broader social visitation. And in some cases, depending on the individual situation, this may mean planning visits in advance or spacing them out because of need. The requirements for being fully vaccinated will continue to be in place, as will tests with rapid tests on entry to long-term care. So just to talk a little bit more about repealing the face coverings order. This means is that masks will no longer be mandatory in those broad ranges of indoor environments that this order sets out. However, some settings will still require that you wear a mask. For example, for healthcare settings, physicians' offices, patient contact. But in most low-risk locations, it will now be an option and no longer a necessity. Critical to success, though, as we move through this transition phase, is for everybody to move at your own pace. We have learned and we know now a lot more about masks than we did a few years ago. They are both a layer of protection for ourselves and, importantly, a layer of protection for those around us. So while masks are no longer required or mandated under an order as of tomorrow, some people in some locations will and continue to use masks personally or in their business. And that's okay. We need to support that. We need to recognize that we all have our own risks and our own vulnerabilities. And particularly if you are older, if you're immune compromised, you may still wear a mask in some locations, especially if you're inside or around a large number of people that you don't know. If you've not yet had your booster or your children are not yet vaccinated, then masks continue to be a very important protective layer that you may want to continue to use, especially in larger crowds and indoors. If we, in part of the mask order was that COVID safety plans needed to include masking in common areas of workplaces. That is no longer an order, but in many workplaces, masks will still be required. They just will no longer be mandated in those areas. Masks continue to be encouraged in some of those settings where we have to get close to other people and we can't necessarily avoid it, in things like public transit and on BC ferries. But they're no longer, as I said, mandated under an order. The other important sectors that this affects, of course, are childcare and early childhood education and our K-12 sector. So childcare guidelines we're going to be revising them. We're in the process of revising them with our childcare and early childhood educator stakeholders, and they will be updated to reflect the different risk levels and the use of masks. And the K-12 school guidelines as well. And this means that masks will no longer be required in all settings in schools once children and staff return from spring break. So we recognize that spring break is slightly different in the 60 school districts across the province. Some, a good portion start tomorrow, and a number start the end of next week. And so what we have done is made sure that all of the revisions in the guidance will come into play when you return from spring break at whenever that is for each school district. And if you're not sure which school district it is, there'll be a link to that on the website with the order. Additionally, those workplaces that are federally regulated will need to continue to follow federal health orders and guidelines around workplaces. So what's ahead? In addition to the changes in orders and guidance for today that start soon, we intend to remove additional orders in another 4 weeks, effective Friday, April 8th. And that is, of course, assuming that our conditions continue to improve. These will include the BC vaccine card will no longer be required in those indoor settings and higher risk settings and events. The businesses will transition from the workplace safety order, which requires COVID-19 specific safety plans, to the previous plans that we had in place last summer, the communicable disease plans. So those will be specific to each industry or business. In addition, we're going to be repealing an order that requires post-secondary students who live in residence to be vaccinated. And workplaces will transition back to this requirement rather than having the broader communicable disease plans in place. Oops, sorry. So those are going to be effective on April 8th. As we said, we're going to take a balanced and transition approach over the next few weeks. I do also want to talk about the Regulated Health Professionals Order. As you know, earlier this week we published the current part of the order that requires regulated health professionals to report to their college their vaccination status by the end of March. And this has been a change in how we're approaching this order, given the situation that we're in right now, but also given our ongoing consultation with the various colleges that are affected. So we want to ensure that colleges had the ability to collect that information from registrants and to do it in a confidential, as well as making sure that we had the ability to provide options to people in the regulated health professions, including the new protein subunit vaccines like Novavax. And there has been a delay in our receipt of Novavax. We had expected it to be in the province by last week, and it looks like now we may not receive it until either the third or last week of March. So I think that's a very important consideration, both for those people who already have been affected by orders in their workplaces, but also for the regulated health professions. We are taking then a measured approach based on the risk and impact with each individual college as we go forward. So that means we will have in place a measure for informed consent so that people can understand that there'll be disclosure to clients or patients of vaccination status for some of the regulated health professions. And for others, there may be additional measures that we need in place. So yes, this is different from our original vision, which would be people not being able to practice if they were not vaccinated by March 24th. We've been working through the specifics with each individual college, and based on the risks within each profession, there will be a component of public reporting, as I said, and then we will continue to take additional measures as needed, considering the important impact on from each individual provider. I do want to say as well that our aim is to be consistent with the healthcare worker order that we already have in place that has been so important in supporting us, particularly through the Delta and Omicron waves in our healthcare sector, in health authorities and hospitals in the community. It is an important measure that ensures we have continued high level of immunity in our healthcare sector as we go through this transition phase and prepare for what comes next in terms of SARS-CoV-2, because this virus is still with us. We are not yet at the place where we enough and we know the patterns and the changes that this virus will undergo and to be able to call it endemic. But we are learning to live with it in a more sustainable way at the same time as supporting people to recover from the measures that we've been through for the last 2 years. So really, while we are able to announce these changes today, it's very important that we continue to follow our safety basics as much as possible to keep COVID-19 low and slow. In particular, I continue to strongly urge you to ensure everyone in your family is vaccinated and have your booster if you have not already done so. These are layers that are important for us to be using all the time. But we are in a transition phase. We need to be ready and prepared for what the virus may bring next. And there are many different scenarios that we are working through to make sure we understand the potential, particularly as we go into the fall. But right now, the important things all of us need to do are monitor ourselves for symptoms, making sure we stay home if we're feeling unwell, get tested, and we now have increasing access to rapid antigen tests to help support you in making those decisions. Washing our hands regularly, staying home if we're not well, getting boosted, and ensuring we get vaccinated. And importantly, as we have done through this whole pandemic, we need to respect people's comfort levels and their own risk levels. And we've talked about this in a number of different ways. We all have our own risk, and we may not be aware of the risks of those around us. We need to be respectful about mask wearing. We need to be respectful about people's choices to keep their gatherings small or to stay outside rather than inside. And while today is another really positive step forward, we have to be ready to bring some tools back, if necessary, depending on the situation as it changes. We are also paying a lot of attention about what's going to happen next. It's become clear to us that COVID is going to be with us, that SARS-CoV-2, this virus, will be circulating communities for time to come. And it means that we have to add it as another virus that we need to pay attention to and manage in an ongoing basis, along with the other serious respiratory illnesses like influenza and RSV. And so that is the position that we're taking, that we're looking at through what are the surveillance mechanisms, what do we need to monitor over time to help us understand the impact on our communities, when we're starting to see surges, if the virus is changing, what's the impact on hospitals and our healthcare system. So we are continuing to do population level sentinel surveillance, and we'll be integrating it with our influenza and RSV surveillance over the coming months. We'll continue to do facility-based monitoring in acute care and long-term care. We have systematic early warning signals through things like our wastewater surveillance, which will be expanding to more communities and to include more pathogens, more bugs. We'll also be doing systematic targeted serological surveillance. We've done that at periodic times where we've tested samples of blood from people in the community by age to determine levels of immunity, and that's one of the reasons why we could present the data that I showed earlier. And we'll continue with our whole genome sequencing to understand how this virus is changing over time. I recognize the changes we're announcing today will make some people very uncomfortable. It has been a long and trying 2 years. Our masks and other safety layers have provided a level of comfort and protection for all of us, and it's why it's important for everybody to move at our own pace. I want to assure you that I feel confident about what we are doing and that we are in a place to do this now. These decisions are grounded in science and in the data that we have about what's happening in our communities for where we are right now. We're able to make these changes, and the ones that are ahead, for two very important reasons. First, because people in British Columbia have stepped up and protected themselves and their families by getting vaccinated. And second, because people have followed these safety measures we've put in place when it was necessary to do so. The need for every single one of these particular layers of protection has dropped below the threshold where we need to have an order for them to be in place. That means we can move from a mandated approach to an empowered self-management approach. We've all learned how to wear masks and when it's important. We've learned about the importance of staying away from others if we're feeling unwell and when to get a test. These are all things that we will need to continue to have to manage in ourselves. It's a good place for us to be, and I'm optimistic that we'll be able to continue this path, at least for the spring and summer months ahead. We have that high level of immunity and understanding right now. But we continue to do this with respect for each other and for our own decisions, whether it's wearing a mask, whether it's gathering outside, whether it's taking those same cautious approach that have gotten you through this far. And we need to continue to do this with compassion for each other and with kindness. Thank you.
Thank you, Dr. Henry. Today I'll provide an update, hopefully a shorter update, to give lots of opportunity for members of the media to ask questions, an update on rapid tests and surgical renewal. But first I want to express my thanks to British Columbians for their significant efforts and willingness to make sacrifices to keep themselves, their loved ones, and our most vulnerable citizens safe. And special appreciation as Minister of Health to healthcare workers everywhere in BC and all they have contributed at every level in home care and home support, the people who provide food and clean our hospitals and our long-term care facilities, our health sciences professionals, our ambulance paramedics, our doctors, our nurses, our healthcare workers, our care aides. They have been, throughout this pandemic, heroes to all of us and to me. I want to express my appreciation for all that they've done And I'm proud that we have a healthcare system. 180,000 strong, 50,000 in long-term care, 130,000 in the main healthcare system, all of whom, every one of whom, is vaccinated. How we have healthcare workers who are determined and committed to supporting all of us in a challenging time. We have today, we're going to have today, when the numbers are announced, less than 400 people in acute care. Well, that's 400 people on top of all the other people who need health care every day. There are today 9,400 people, and of course people dealing with challenges in long-term care. And I must say that I was particularly happy with the proposals that Dr. Henry has made and that will be put in place to allow broader visitation in long-term care again, for long-term care residents to have multiple visitors, all vaccinated, all tested, and all there to provide love and caring and engagement and support to people who live in long-term care, to ensure that what we're doing, what we want long-term care to do, which is not just be a place to support people who have also a place where people, despite those health challenges, have the freedom to live and express themselves in their lives. I want to bring an update then on the number of rapid tests in BC. As of March 9th, BC has received 35,346,600. We continue to prepare for the arrival of tests at approximately 3 million per week over the coming weeks. 26,048,282 tests have been deployed to key strategic areas. I've described those at length in future briefings, but I would be happy to describe them to members of the media who seek that information again. The total number of tests distributed through all our distribution channels across BC since our last briefing, that was March 1st, is 4,147,515. As previously noted, just over 500,000 tests, or 558,000 of our inventory, are not set for deployment for personal use and are being used at the discretion of medical health officers in the appropriate settings. That leaves a current inventory of 8,742,800 tests suitable for self-administered use. To date, 4.4 million tests have been distributed to K-12 schools across the province, 2.1 million tests have been distributed to post-secondary institutions, and 5.3 million tests have been sent to pharmacies. As announced last week, these tests are for British Columbians aged 60 and older to pick up a kit containing 5 tests at participating pharmacies. This age group is a priority because the evidence indicates that they are at more serious risk of serious consequences should they become infected. If they become symptomatic, the tests will allow them to determine if they may have COVID-19 so that they can take the actions that are required. And as of this morning, 1,323,430 tests have been dispensed by 1,287 pharmacies. I'd say that as of tomorrow, we will be lowering the age category for access to tests tomorrow to those 50 to 59. So those will start to be available for those age 50 to 59 starting tomorrow. And for more information on accessing test kits, British Columbians can visit bcpharmacy.ca, and I want to express my appreciation to pharmacists across British Columbia for all of their work, both in our vaccination program, in the influenza vaccination program, and of course in the deployment of rapid tests. Increased test availability means that more members of the general population will be able to access tests to use to understand their own symptoms and illness and take action to limit transmission to their family, friends, and work, including those at higher risks. I want to also provide an update to our surgical renewal initiative. Health authorities report that as of in the week of February 6th to the 12th, 6,442 surgeries were completed in BC. And that's a significant number. We'd also wanted to say that from February 27th to March 5th, the most recent week, obviously before us, health authorities postponed 64 non-urgent scheduled surgeries. That number continues to decline. That's 1 in Fraser Health, 62 in Interior Health, and 1 in Vancouver Coastal Health. No surgeries were postponed. Just wait for the bells. No surgeries were postponed in the Vancouver Island Health Authority or the Northern Health Authority or the Provincial Health Services Authority. Cumulatively, from September 5th, 2021 to March 5th, March 5th, 2022, regional surges of COVID-19 and factors including severe weather patterns have caused 8,098 surgical postponements. I would note that more than half of those postponements now have received their surgery, more than half, which is an exceptional achievement, and we will continue over the coming weeks to book surgeries, to get people the surgeries they need. Our whole healthcare system is committed to that, and I am committed to that personally, but I know our outstanding surgeons and nurses and healthcare workers who are involved in this are committed to it. And I think it's significant to say that those rebooking of surgeries, I think, speaks of the work that all of us have done. That in the moments that mattered most in the Omicron wave, we each made the difference essential to stopping the rapid spread of COVID. And in doing so, in reducing hospitalizations from 1,009 on January the 31st to 388 today, we've had a major impact on our healthcare system in a positive way. It means now that we can rebook surgeries, but our work is not done. As Dr. Henry has said, the COVID-19 virus and the COVID-19 pandemic will continue to challenge us. The measures taken today are a positive step, and they reflect where we stand today. But we are always humble for a virus which lives to transmit and finds different ways to transmit, and humbled towards the people of BC, who have, in very challenging ways and in difficult ways and in ways that we could not have imagined when we formed our own emergency group to deal with the COVID-19 pandemic in January of 2020, or 2 years ago tomorrow when the declaration of a pandemic was made. The sacrifices people have made and the things they've done for one another and the kindness they have demonstrated to one another has been, I think, something that all British Columbians can take pride in. There will be more tests ahead. There will. And I know we're prepared to stand together in these important moments, stand together and support one another. To be careful, yes. To be safe, yes. And also to be kind. And I think that is, if there are lessons on this day, it's that the things that have allowed us to respond to the pandemic in the past are still with us, which is a great province, great people, and outstanding healthcare workers everywhere in BC. And with that, I was about to say Honourable Speaker, how about that? I'm in the building. I won't say that. But with that, all of you, we're happy to take your questions.